The human body is a symphony of intricate processes, orchestrated by a complex network of glands known as the endocrine system. These glands secrete chemical messengers called hormones, which regulate a vast array of bodily functions, from growth and metabolism to mood and sleep. Among these vital players are the thyroid and parathyroid glands, small yet powerful conductors that play a critical role in maintaining the body's delicate equilibrium. Nestled in the neck, these glands might seem inconspicuous, but their influence is far-reaching. They are instrumental in regulating metabolism, calcium levels, and overall physiological harmony. Understanding the intricacies of these glands, their hormonal secretions, and the potential consequences of their dysfunction is paramount for any aspiring medical professional. This exploration delves into the world of the thyroid and parathyroid glands, unraveling their anatomy, hormone production, intricate regulatory mechanisms, and the clinical manifestations of their disorders. By understanding these fundamental concepts, we gain invaluable insights into the delicate balance that governs our well-being. Join me as we embark on this journey to decipher the language of these endocrine maestros and appreciate their profound impact on human health. Our exploration will not only equip us with essential medical knowledge, but also foster a deeper appreciation for the elegant complexity of the human body. The thyroid gland, a butterfly-shaped endocrine gland, sits prominently at the base of the neck, just below the Adam's apple. It consists of two lobes resembling butterfly wings, connected by a narrow band of tissue called the isthmus. This strategic location allows the thyroid gland to exert its influence on various bodily processes. Microscopically, the thyroid gland is composed of numerous spherical structures called follicles. These follicles are lined by epithelial cells that produce and store thyroid hormones. Within the follicles lies a gelatinous substance called colloid, which serves as a reservoir for thyroid hormones, ready to be released into the bloodstream when needed. The thyroid gland's rich blood supply reflects its metabolic importance. It receives blood from the superior and inferior thyroid arteries, ensuring a constant supply of nutrients and oxygen. This intricate network of blood vessels also facilitates the efficient transport of thyroid hormones throughout the body. Understanding the anatomy of the thyroid gland is crucial for comprehending its function and the potential consequences of its dysfunction. Its unique structure and strategic location underscore its vital role in maintaining metabolic equilibrium and overall well-being. The thyroid gland produces two primary hormones, triiodothyronine, also known as T3, and thyroxine, or T4. These hormones are crucial regulators of metabolism, influencing energy expenditure, protein synthesis, and the body's response to other hormones. T3, the more potent of the two, is produced in smaller quantities by the thyroid gland. T4, the more abundant hormone, is converted into T3 in the liver and other tissues as needed. These hormones act on nearly every cell in the body, binding to specific receptors that regulate gene expression. In addition to T3 and T4, the thyroid gland also produces calcitonin, a hormone involved in calcium regulation. Calcitonin helps lower blood calcium levels by inhibiting the release of calcium from bones and reducing calcium reabsorption in the kidneys. The intricate interplay of these hormones underscores the thyroid gland's multifaceted role in maintaining homeostasis. Their influence extends far beyond metabolism, impacting growth, development, and the body's response to various stimuli. The production and release of thyroid hormones are tightly regulated by a complex feedback mechanism involving the hypothalamus, pituitary gland, and the thyroid gland itself. This intricate system ensures that thyroid hormone levels remain within a narrow range, preventing both deficiency and excess. The hypothalamus, located in the brain, initiates this cascade by releasing thyrotropin-releasing hormone, or TRH. TRH stimulates the pituitary gland, also in the brain, to produce thyroid-stimulating hormone, or TSH. TSH then travels through the bloodstream to the thyroid gland, where it binds to specific receptors and stimulates the production and release of T3 and T4. As T3 and T4 levels rise in the bloodstream, they exert negative feedback on the hypothalamus and pituitary gland, reducing the production of TRH and TSH respectively. This feedback loop ensures that thyroid hormone production is adjusted according to the body's needs. This delicate balance is crucial for maintaining metabolic equilibrium. Disruptions in this regulatory pathway can lead to various thyroid disorders, highlighting the importance of understanding this. Section 5. Thyroid disorders. When harmony is disrupted, when the thyroid gland malfunctions, it can lead to a range of disorders, broadly categorized as either hyperthyroidism or hypothyroidism. These conditions can significantly impact overall health and well-being. Hypothyroidism, characterized by an underactive thyroid gland, results in insufficient production of thyroid hormones. This deficiency slows down metabolism, leading to a constellation of symptoms such as fatigue, weight gain, cold intolerance, constipation, and depression. Hyperthyroidism, on the other hand, involves an overactive thyroid gland, producing excessive amounts of thyroid hormones. This surge in hormone levels accelerates metabolism, leading to symptoms such as weight loss, rapid heartbeat, anxiety, tremors, and heat intolerance. Graves' disease, an autoimmune disorder, is a common cause of hyperthyroidism. Other causes include thyroid nodules, which are abnormal growths in the thyroid gland that can sometimes produce excess hormones. Treatment for thyroid disorders typically involves medication to either supplement or suppress thyroid hormone production, depending on the underlying condition. Understanding the causes, symptoms, and treatment options for thyroid disorders is essential for early diagnosis and effective management. Section 6. Parathyroid glands, tiny glands, big impact. While the thyroid gland takes center stage in the neck's endocrine orchestra, the parathyroid glands, 4 tiny glands located on the posterior surface of the thyroid gland, play an equally vital role in maintaining calcium homeostasis. These small but mighty glands secrete parathyroid hormone, or PTH, a key regulator of calcium levels in the blood. Despite their diminutive size, the parathyroid glands exert a profound influence on calcium balance, a crucial aspect of numerous physiological processes, including nerve function, muscle contraction, and bone health. Their strategic location adjacent to the thyroid gland highlights the interconnectedness of these endocrine regulators. Understanding the anatomy and function of the parathyroid glands is crucial for comprehending the intricacies of calcium homeostasis and the potential consequences of parathyroid dysfunction. These tiny glands, often overlooked, play a monumental role in maintaining the body's delicate equilibrium. Section 7. Parathyroid hormone, the calcium guardian. Parathyroid hormone, or PTH, the primary hormone secreted by the parathyroid glands, acts as a vigilant guardian of calcium levels in the blood. When calcium levels dip below a certain threshold, the parathyroid glands release PTH into the bloodstream, triggering a cascade of events to restore calcium balance. PTH exerts its effects on 3 primary target organs: bones, kidneys, and the intestines. It stimulates the release of calcium from bones, enhances calcium reabsorption in the kidneys, and promotes the activation of vitamin D, which in turn increases calcium absorption from the intestines. This intricate interplay of hormonal actions ensures that blood calcium levels remain within a narrow range, crucial for maintaining the integrity of various physiological processes. PTH's role in calcium homeostasis highlights the parathyroid gland's critical contribution to overall well-being. Section 8. Regulation of parathyroid hormone, a feedback loop. The secretion of PTH is tightly regulated by a negative feedback loop involving blood calcium levels. When blood calcium levels fall, the parathyroid glands sense this change and increase PTH secretion. Conversely, when blood calcium levels rise, PTH secretion is suppressed. This feedback mechanism ensures that PTH secretion is constantly adjusted to maintain calcium balance. This delicate balance is crucial for preventing both hypocalcemia, or low blood calcium, and hypercalcemia, or high blood calcium, both of which can have significant clinical consequences. Understanding this regulatory pathway is essential for comprehending the pathogenesis of parathyroid disorders and the rationale for their treatment. The parathyroid glands, though small in size, play a monumental role in maintaining calcium homeostasis, a testament to the intricate complexity of the endocrine system.